Okay, good morning, everyone. This is our second of the CBD rounds where we do an introduction to CBD for our ophthalmology faculty. As many of you know, our first year residents started in the CBD curriculum last July and have completed the majority of their first year already, and they are going through the CBD curriculum. This means for us that starting July, we're going to have ophthalmology residents full-time in our clinics and in the future in our ORs who are going through the ophthalmology curriculum. And we need to be prepared to deal with the new curriculum and the evaluations that go with it. So today's session is meant to be hands-on and hopefully leave everyone with the ability to complete an evaluation. I do want to introduce Charles Andreessen, who is the curriculum coordinator, who's been working closely with Steph Kletke and I on the implementation of CBD in ophthalmology. And once again, recognize Steph Kletke as our CBD lead for the Department of Ophthalmology and Vision Sciences. We've been very fortunate to have her take the lead as our CBD lead. And I think you guys are going to really recognize the efforts that she's made come July when the residents start to roll in through our clinic. So Steph, thank you again. And Charles, thank you for presenting this morning.
Thank you for having me. Can I jump in?
Yes,
okay.
Floor is
yeah,
yours.
Thanks everyone. No worry, thanks for having me. So as Amandeep said in my introduction, this is part 2 of the CBD sort of intro session. Purpose of this week will primarily be focused on the EPA assessment platform itself, Elentra. Stephanie has kindly prepared a sample case study, which we'll use to focus upon, or well, it'll help focus our demonstration and kind of a group completion of one of the EPAs that assessors will commonly, the opportunity to complete will commonly present itself within, I guess, early on and throughout PGY2 and onward for the CBD trainees. So I'm going to share my screen here and just begin here. Okay, everyone can see the PowerPoint slide here. So yeah, we're focusing on, as I mentioned, part 2 of this of this session here. So I don't know if I shared before most of you could join. I can reshare it, a link in the chat to Elentra. Can you all see that? It's that meded.utoronto/medicine URL.
It's not there, Charles.
Okay.
Maybe you want to share it again.
Yeah, let me do that here. Oops. Just hold that up. So yeah, you're all encouraged to follow along. We've created a demo user account in the system for you to use, but you first need to log in. So you'll all want to have your UTOR IDs handy and the associated accompanying password associated with that. Okay, so thanks for your patience. Hopefully you can see that. Oh, let me resend it. I guess it was just sent to host and panelists. So this link should hopefully show up now. I can bring it up on the screen as well for those of you in the conference room. Okay, so you can see this here. So for those of you just following along in the classroom there, this is the URL, meded.utoronto.ca. You'll be directed to central UofT landing page where you'll be prompted to enter your UTOR ID and the accompanying password. Okay, so the point today is just to primarily access Elentra. I'll give you the link for accessing Power, but those are, that's primarily for the end of rotation evals and the ITARs that you'll be filling out at the end of each rotation, not the point of today's, not the purpose of today's session here. And we'll briefly cover, before jumping into kind of the group demonstration and follow along, some common tips for providing feedback and coaching to residents through the completion of EPAs. So here we are again. If anyone is having issue logging in, we can either deal with that at the end of the session, or if enough of you are unable to, we should probably address that prior. And I can follow up with our systems team after the session to confirm that. we have the right account for you in the system, and if necessary, help you track down and reset your util ID and password. Okay, so I am going to now just jump over, I suppose, to my my URL, to my Elentra page here. So bear with me here. So okay. So when you log in to Elentra, you're directed to this landing page here. I'm logged into my admin account, so there are a few more things here that you may not see. But for faculty, those who do not have program director or program admin access, you will have a tasks and results tab here or link, start assessment, and you should have the help here. Under this tasks and results dashboard, there are several sub tabs, assessment tasks, my completed. You should, well, if you're just faculty, you'll just have these first three here. Here you can track outstanding EPA assessments that you have either triggered or trainees have sent you to complete. And any EPAs that you have completed can be found and reviewed on this my completed tasks tab here. As relevant to this discussion, though, will primarily be, of course, the triggering and completion of the EPA. So I'll just sort of walk you through the process for beginning those. So clicking on this start assessment page here will direct you to this workflow through which, populating the various steps here, you'll be able to trigger and launch an EPA assessment. So first and foremost, under this on-demand workflow, it will default to the EPA. As an aside, this platform can also be used by trainees to trigger the learner assessment of clinical teacher, the LACT form, on demand at any time to review, their experiences working with a particular supervisor, faculty member. Also for faculty, on the rare instances where it's required, they can you can submit notes to file on a trainee, or in the exceedingly rare cases, professional behavioral monitoring forms as well, which more relevant to the program director here, as they will be the only ones who will receive notification of those. But that's a digression. So for the EPAs, you first will begin by selecting the assessor if you're a trainee, or the assessee if you're just the faculty member. Typically, these, will be triggered following the observation of a particular patient encounter, right? I mean, you, when triggering an EPA assessment, are doing so with the expectation of just evaluating that sort of snapshot of that particular moment in one's training and PGY2's training, right? You're evaluating them, as they're, in relation to peers of that same level of training, that stage of training, right? You're not evaluating or assessing them as you might given expectations of a fully licensed, fully, graduated ophthalmologist. It would just be their experience level commensurate to where they are in that training, right? So how a PGY2, or in the CBD parlance, how a foundation of discipline trainee or core of discipline trainee should, how they should be doing that particular instant there. So I'm going to use my name. We can begin, if you wanted to begin following along, just to tinker around, you're welcome to do so. I'm going to pop into the chat as well. We won't get too far into the weeds of this, but I did upload. I can find it, bear with me, sorry. Okay, I will pull this, but we do have a demo learner that I did. I did enroll in the program here. This is unfortunate, I cannot find it. Okay, well, sorry here. Let me just go back to this and I'll just walk through it here. Okay, so you would begin by typing in the name of that learner. If you are following along, this is the one to do, Demo Learner 2024. I just began typing in the word demo, and you'll see this fourth option that appeared here, Demo Learner 2024. Ideally, best practice, right, would be to be completing an assessment in the moment with the trainee, sort of immediately following the moment of encounter. But obviously there might be time constraints which limits one from doing that. But recently we've introduced a cap on how far back retroactively one can go in and trigger an assessment. So when triggering an EPA assessment, it has to be, it can only be within a week, or going back 1 week from the date that you're taking the time to trigger it here. I have a question from someone in the chat here. Are we going to be doing this for undergrads? That's a good question. There is an iteration of Elentra on the undergrad side. The workflow and processes for, for accessing that is slightly different than this. Typically speaking, I mean, expectations that you might have with working with the clerks would be, I guess, explained to you on that side of things. We're primarily looking at the post-grad side of it. But in most cases, while we do want this to kind of be an equitably shared burden between faculty and trainees, it's fair to expect that the clerks will probably be more familiar with it and will probably drive that process unless you're told otherwise, prior to beginning your work with them. Okay, so selecting the date of encounter. If and when a trainee triggers this, they have an option, a second option under select assessment method. So you as faculty primarily, you solely have the option to complete now, which requires you to be physically present with the trainee, completing it on a shared device with them. This, of course, is ideal. It's kind of encouraged insofar as the greatest opportunities for coaching and feedback would exist when you're able to be discussing the case with them while completing this. But the PGY2s, the trainees, CBD trainees, also have the option to complete and confirm via email. So they can launch the form, they can partially pre-populate it, and then send that out via email to the assessor they've selected. So the email that it will go to is the one that was associated with the particular faculty member when we created an account for them in Elentra. So if you've logged in as a faculty member and are following along and you want to confirm that we have the right email, just as an aside, you can scroll up to the top, click on your name. They'll bring you to your profile and it will list your primary email address and you can change that if necessary. Okay, so it will default select the program of the trainee. Below that, the drop down with all of the EPAs within your program. For the purpose of this session, Stephanie had selected Core of Discipline 1 as a best example for us to follow. Just as a brief reminder, right, EPAs are nested within 4 stages of training. One must progress through one stage, i.e. complete all of the tasks and activities within a given stage before advancing through to the next. I believe your PGY2s will be in that second stage foundation of discipline to start. It is possible for them to work ahead on later stage EPAs, which is why I believe we selected COD1. So
yeah, Charles, they'll be in foundations for approximately 3 months, and then they're anticipated to move into core.
Great,
So
and that would be for 2+ years, correct?
That's meant to basically extend from PGY2 to PGY4. So it's quite a long stage.
So there will be plenty of opportunities. It's a common enough case, and there'll be plenty of opportunities that arise to be assessed in the completion of CPA, right? Okay. Thanks, Stephanie. So we perhaps simultaneous to jumping in on this, I'm just going to preview this form, show you what it looks like. Can also review. So the EPA itself, right? The EPAs are provided to us, or sort of, finalized and disseminated by the Royal College. This is not the correct one. In, that sort of tabular format we were looking at here. So the different components from this are translated onto the form in Elentra, right? So we have the title of that EPA at the top, performing history and examination, adaptive patient, ophthalmologic disorder. Items that appear under this assessment plan would have been separated out into necessary components or contextual variables that must be completed, must be identified as sort of core components for the assessment of this given activity. There are also associated targets with it. So in the previous session, we've spoken about entrustment targets. So for this particular case, a trainee must be be absorbed, or sorry, but must be observed a minimum of 12 times and have either demonstrated competence or proficiency at this particular task. In addition, there are sub-targets to that must be completed, right? So of the 12, 2 each of external disease and cornea, glaucoma, so on and so forth. Comments in the chat here. Oh, thank you, Stephanie. Stephanie has shared the EPA guide. So yeah, scroll down through to COD1 to look at it and follow along. It's a useful resource to have on hand, obviously, to familiarize yourself with expectations laid out by the Royal College Specialty Committee. Obviously, you are all experts in these particular tasks, but it can be beneficial to kind of see what the specifics of assessment are being, have been sort of cornered here to covering the assessment here. So below that are those milestones, and that kind of gives kind of a broad strokes idea of what one would be expected to evaluate. Okay, so I'm going to jump back to, I had the sample EPA up here. So with that EPA guide, like I said, we translated to that. So when you as an assessor launch this tool, there are a number of associated contextual variables, right? So all of these drop-down menus are demographic items from which need to be, you would need to select an answer thing, right? So most faculty member, or most folks filling this out will be faculty. They would indicate their role as university appointed faculty, indicate whether this particular case was directly observed or the evaluation is through review of notes and discussion. Whether it was, you can see requiring low vision rehab or not. So in preparation and launch of these tools, Stephanie and Amandeep indicated or worked with us to indicate which training rotations this EPA or the opportunity to complete this EPA will arise on. So all of those associated or possible opportunities are listed here under the rotation services. Lastly here, there is a drop-down live search menu where you can type in and select the site on which it occurs. So that is quite comprehensively linked to all of the training sites that are used across all of the PGME training programs. If by chance there is one missing, if there's a specific private ophthalmology clinic, let's say, you can let your program know and they can reach out to us and we can add that as well. Lastly, you would indicate the type of case and procedure. So each of the contextual variables associated with, they differ EPA to EPA, but these are the ones that are associated with this particular example here. Following that is the comment section. You're expected to fill in comments as well, right? I mean, that's sort of a key component to feedback and coaching, providing both the trainee with salient, feedback, right, that can help improve performance, provide comparison, benchmarking, also, beneficial value for them to grow, but also for the competence committee who will be reviewing and making the decisions to advance trainees through to that stage and ultimately transition out to practice, right? So having salient construction feedback, helps flesh out the data and provides the decision makers with the means to make informed decisions on proficiency and training.
Charles, before you move on, could you, sorry to interrupt,
yes.
Do you mind going back to the EPA and just showing everyone what a contextual variable is?
Of course.
I think people haven't heard that term before.
Yes, back to the EPA guide here. Is this what you mean, sorry?
Yeah, maybe just could you show us what the structure of the EPA actually is? Just to set the stage and what a contextual variable is, how many collections they might have to complete, that sort of thing. Okay.
Should we look at the EPA targets, the requirements, as opposed to the EPA form itself, you mean?
Either is fine, even just the EPA itself.
Is this visible? Can you see here?
Yeah.
Okay, great. Yeah. So for that, so we're looking at, I'm going to just jump back to here. So we can see here under domain, it lists all of these cases and procedures. We can see, right, that this EPA one of the requirements that this form collects info on whether it required low vision rehab or not. So we would have translated that to this form along with some commonly occurring, required items that occur or that are displayed and required to be filled out across all EPAs, right? So the Royal College specifically requires this particular tool to capture data on whether it was requiring low vision rehab or not. So that appears under type of activity. All of those domains that were listed have been translated to the form under this type of case and procedure dropdown here. So as I mentioned, there are associated targets to this. Utilizing that EPA guide we looked at is one such tool for staying on top of targets and sort of navigating through that. But learners in the system also have the ability to track progress from their own profile here. I'm just going to go to the test program to show you what I mean. So we've uploaded the targets and there's a high level sort of tracking tool through which, this is just a general one here, but each of the EPAs has their own little tile here. Hovering over it brings this little drop down from which they can see all of the associated targets or targets associated with a given EPA listed in bullet form here. And as they progress through, this updates and they can, see how they're progressing and what outstanding targets remain as they work towards completion. Are there any questions or anything further to add about that? Okay. No? Okay. So the ultimate component, right, that determines how one is progressing through CBD, at least from a completion standpoint, is how faculty overall rate a resident's performance in a given chapter here. So as I mentioned, you are, as faculty, are evaluating them in relation to expectations for someone at their particular stage of training. So you want to evaluate them in this particular case on how well you think or how well the expectations are for a PGY2 to complete this task, right, of performing a history and exam. Once that's submitted, right, it goes through, the trainee will have access to that completed data. You will be able to, review that as well. And of course, the Competence Committee members have access to this. But before submitting, you have the option to complete or to provide individual ratings on each of the milestones. So as I mentioned, there are best practice steps associated with each EPA. These have been mapped to the CanMed's roles. Each of the bolded ones that appears on this EPA guide is listed here, right? So you might even, as a medical expert, just be able to ascertain that there's a relatively elementary level to the expectations for this particular EPA, which would, indicate that, the expectations are through the assessment of someone relatively early on in their training within your program. And as you advance through to the later stage EPAs, they might refer to more complex actions or more in-depth, practices that would indicate a greater level of familiarity, competence, and expectations of autonomy with a given activity. Oh, okay. I will throw that question over to a medical expert. In the chat, we have the definition of low vision may come in handy before deciding the need for low vision rehab. So I can see if that's something that was included on the EPA guide, but I'll throw that over to Amandeep or Stephanie. Oh, okay, they followed that up with they're listed in the OHIP SOB. So would that be something that people are familiar, like exceedingly familiar with? Is that something, a resource that people would need to familiarize themselves with prior to the assessment process?
No, I think the schedule of benefits that Sam described is probably pretty good. I was actually going to bring this up with you afterwards, Charles. the need for that particular question for every single encounter. I think it may be excessive to have to answer that every single time, because the majority of the time the answer may be no.
Okay.
So I'll circle back to you after this meeting to specifically talk about that and see if we can streamline that a bit.
Okay, as in update the form.
Yes.
Okay, yeah, we can definitely discuss that. Okay. Right. So these are optional components, but they can also help sort of guide one's assessment of a trainee just through the review of them at least earlier on to, you know, gain familiarity and sort of customize oneself with the expectations. Okay, so following that, right, you have the ability, once you've selected all of the contextual variables, filled in comments, and indicated overall performance level on that, you can submit that, and that will go directly through and finish, or you know, submit the form. Are there any questions about that? That's just sort of like the mechanics of triggering and completing an EPA. No?
Charles, can you show the faculty where they would find an EPA that's been triggered by the resident?
Yes, absolutely. So if you know, if it's something that you haven't has maybe gotten lost in your inbox, so you will receive an email if it's been triggered by a trainee with a hyperlink to that EPA that you can just launch without having to log in and complete. We also have recently implemented a weekly reminder digest that goes out, I think Fridays at 7:30, where faculty will receive an email with links to all of the outstanding EPAs that remain. But if you're logging in and following along, or well, you know, logging in regularly as part of your just so common practice routine to ensure nothing gets lost, so to speak, you would log in, click on your tasks and results dashboard, and under this first tab, assessment tasks, you will find all of the outstanding EPAs. So one thing I didn't touch on is that each EPA, once triggered, has a 2-week completion limit. So you can see here the date of delivery, date of encounter, those of course can differ, but from that date of delivery, there are 2 weeks during which to complete it. If those 2 weeks lapse, you can reach out to your program administrator and they can reset that a single time for an additional week. After which time, I mean, enough time has lapsed that probably the opportunity for like constructive, you know, meaningful feedback might have already passed. I mean, if it's close to a month from the date of encounter, it's likely going to be difficult to recall the specifics of the encounter. Okay, Catherine said, will we get an email after doing every one of these? You will, yeah, so you do get an email confirming its completion and submission as well. Were you asking that, I guess, as a trainee? Trainee gets, okay, as faculty, sorry. Okay, yes. You will get an email as a reminder when it's sent out to you by a trainee, and then you will also get an email confirming its submission as well. Okay. Any other questions about that? Okay. Well, let me jump back to the slides here. So we briefly sort of covered this as well. Let me see here. This is just a sample of what said email reminder looks like here. So it comes from just, you know, a generic automated notification email address, but this link here will allow you to, well, this is the completion one, but similarly to one that's in progress, you can open the link with any open to the assessment without needing to log in. This is that email you will receive confirming completion of a given EPA. Okay, so I also want to remind you, so we have, there's that help tab that appeared on the page that will direct you to a number of user guides and resources we have. At the bottom of each page on Elentra, there is also an email address for our help desk team. So if you have any troubleshooting needs, you can reach folks through that. We won't really go into Power. Gavin yeah, not the purpose of the session, but here's the hyperlink or the URL for that, which you do usually, I think you will receive emails. You'll be prompted to complete the end of rotation evals if necessary, if you've been working with the trainee through the rotation. So you likely will not need to access that there.
Charles, just to clarify, for everyone, EPAs are completed by all faculty in Elentra. The power is only for the ITARs, which are the end of rotation evaluations, similar to the current ITERs. So that's only for site directors.
Thank you, Stephanie. Okay, so I mean, we'll briefly touch on, are there any questions before we kind of move on here? I'm mindful of time as well. No? Okay. Well, we briefly just kind of want to talk about feedback and coaching, right? I mean, EPAs are sort of built around this idea of, coaching in the moment, right? But in order to have that, right, there are certain needs that need to be established, like relationship rapport between the teacher and learner, right? You need to have kind of an open relationship through which you can openly discuss, expectations or learning goals, right? Whether that's something that the assessor outlays to the trainee, or the vice versa, the trainee shares that with the faculty, kind of what their hopes are. All of EPA completion occurs, right? It starts with the observation of the learner through that workplace-based assessment, the EPA, right? And I mean, ideally, right, there should be kind of active engagement in, coaching and discussion, right? We talk about potential hurdles, right? And I think, one of the primary ways to overcome those is through that development of kind of a rapport and a healthy working relationship, right? You talk about the need for a growth mindset versus a fixed one, right? I mean, obviously, more important than kind of this idea of there being an innate ability is, the idea that, a person can, through hard work, kind of achieve success, and right, the feedback garnered through EPA completion is certainly a means to help them kind of grow through there and develop their skill sets there, right? So when we talk about the different types of feedback, right, while reassurance, is certainly helpful, like, it can be quite difficult when a trainee is doing quite well to provide any sort of feedback. It's hard to find something. It's not necessarily the case that you need to provide something critical if they are doing exceptionally well, right? But I mean, ideally, for focused sort of performance improvement, right, it's important to be able to provide the means that can help the trainee unlock ways on how to do something better and how to improve here. We talked about just sort of these 8 common ways to sort of give and receive feedback, right? Confirming whether, asking whether they want feedback on X or Y is important, and vice versa for the trainee. They might approach you asking for tips, but it's a two-way relationship, and, you want to ensure that, you're also open and willing to take the initiative and offer feedback when working with a trainee. In terms of determining what kind of type of feedback is required, seeing what they did well on, right? Kind of a sense how they're progressing compared to peers, what can be done to improve, so on and so forth, right? It's important to find time, sort of carve time out. Obviously, it's easier said than done through the course of one's day, right? Finding the time and space to provide feedback, whether it's informally or through the completion of an EPA, maybe finding time to sit down with them and chat and work through the completion of that form, going through that feedback together, right? It's important, and ensuring that it is clearly feedback that is being given. And like when we talk about sticking to the facts, particularly when we're talking about EPA completion, we're talking about just this being an evaluation of a specific patient encounter, right? So, I mean, you want to stick to the specifics of that moment, not necessarily, I mean, doing as best you can to sort of isolate that from your working relationship with them, how they've done in the past, right? Months before, right? We're just sort of sticking to the observation of how they work that particular, in that particular encounter. And I mean, it's helpful to provide the means of, kind of prompts for reflection, right? Like prompting the trainee on how it can also help guide the feedback you give, asking kind of what they perceive they're doing well or sense what they're struggling with, so on and so forth. And I mean, it's helpful to have conversations around ways to improve, right? And plans moving forward and what you as a faculty member can provide as means to improve as well. And I mean, if possible, if there's time, right, when completing those forms, maybe providing a couple specific things that could be done to take, one's performance to the next level, so to speak. Very high level, I know, but just something to be mindful of. We have a couple of resources, there are links I'll be sharing. Well, I'll be sharing these slides with some links to a pocket card with some of those sort of conversation prompts for both assessors and assessees. That one, you might find useful when you're looking at, as well as a handout with kind of just a high level conceptual look at, feedback and coaching to help sort of drive that process as well. Anything, Stephanie or Amanda, do you have anything to add? Or are there any other questions for folks?
I think that was great. Couple things. If we could also put that email address up that you had at the beginning, if anyone's having difficulty accessing Power, or their UTOR ID, I'm sorry, their UTOR ID. I think that would be helpful. I'll circulate that email as well to all of our faculty, because I imagine some folks are having difficulty with that step. This is going to be a work in progress for all of us come July. And so we will lean on these resources that Charles has put up, and we'll share those with the group as well. Thank you.
Great. Okay, so I'm mindful of time, and I know one of the primary objectives here is for those participating to actually submit an EPA here. I think we'd already spent sufficient time reviewing C1. I'm going to bring up the case notes that Stephanie had provided, and perhaps Stephanie can speak more on those, and then we can go back to where we were in Elentra and just submit that form. And if there is time, hopefully there is, we can debrief and discuss kind of that feedback. Okay. Okay. I can scroll through it for you, but ready whenever you are.
Can you make it a little bit larger, Charles, if possible? Thank you. So I guess we can just scroll through and people can read at their own time. So this is just an example of a case that would commonly be seen in by the PGY2s in a general ophthalmology clinic. So this specific EPA involves case discussion with the supervisor, as well as direct observation of a physical exam by the assessor. So obviously that component of this evaluation is not going to be feasible, but this is more meant to provide a general example, and then we can more work through the EPA together.
I think I can share this link in the chat too, actually.
That might be helpful, Charles. I think I can do it here. One second.
Or did you?
Charles.
Okay, thank you.
Yeah.
I'm floundering here.
So there's an example of a history that the resident would provide. The exam, we've just listed some pertinent findings, though the actual evaluation would be on their exam, as well as documentation and findings. This specific EPA, I don't know if we can pull that up too, Charles, but they're meant to provide a list of possible investigations as well as a differential diagnosis. So that's all been provided in the Word file here.
Okay. We'll give some folks some time to review this, and then we can jump back over to Elentra.
Sure.
So Charles, why don't we go ahead?
Yeah, yeah.
So Nancy's saying she doesn't see a link. Nancy, we're just back in the med ed link that was at the beginning of the presentation to complete an
Try to
evaluation
repost it.
or to Elentra.
Okay, so starting an assessment here. We'll go back here. So if you're following along as faculty, right, select assessor, it should, it will already be associated with your account. You don't need to select that. Following along, use the demo account, demo learner 2024. I can put that in the chat as well. We'll just select a date counter here. And from the select EPA dropdown, scroll down to C1, performing a history and exam adapted to the patient's ophthalmologic disorder. Okay. We'll click on begin assessment. So your info will appear on the left as the assessor and then the demo under assessing. So go through. Oops. We can make, for the sake of completing this, right, I mean, we can refer to the case notes here, but you'd make selections of these drop downs based on first year role, right? Whether it's directly observed, whether it required low vision rehab or not, which by sound it might be a redundant or unnecessary. So I believe Stephanie will or Amandeep, the trainees will all start the year on this general ophthalmology rotation.
Yes.
Yeah. Okay.
Yeah, the entire year is general ophthalmology, just at different sites.
Okay. Okay. That would be the one most. And then I don't know. You begin just by typing in and it narrows down. I don't know if this is wearable training, but I'm selecting Kensington Eye Institute. And I don't have that test case or, the case study in front of me or the case notes, but right, selecting type of case based on that. The next step, right, of course, are filling in the comments here. So, I mean, this ideally, or this is where I think the majority of time would need be spent, right? You don't need to write, paragraphs or reams worth here, but something that can provide, benchmarks for the trainees, right? Or, means for improving their practice, right? Based on the specifics of that particular encounter here, right? I mean, they may have done a terrific job, but ideally, you'll have more to write than just great job. Catherine says the drop-down program is not showing ophthalmology. And you selected, did you first start by selecting that demo learner 2024?
So Charles, some folks may be having difficulty accessing Demo Learner 2024. I myself wasn't able to access that.
Oh.
Ken is not able to either. So I think we're having some difficulties with the Demo Learner. And perhaps just for the purposes of today's presentation, we just complete it on your screen and everybody follows along there.
Okay.
There's the difficulties actually with the Demo Learner 2024.
Sorry. Okay. That's unfortunate. Okay. So, well, yeah, that's annoying. Okay. I'll try and sort that out after the fact. So yeah, based on the specifics of that encounter, right? Use that to guide your comments, right? Things that they did well in that first box under things to continue doing, things to work on, right? Right, talking about the means for improvement under that second box there. Following that, right, based on either just your knowledge of that particular encounter or of that specific activity, provide your overall rating, or if you want further sort of context on what the expectations are within this given EPA, you can scroll past and review the milestones associated with that EPA, right? You don't need to fill any, all of these out individually, but it can be a useful, it can be a useful exercise for folks that. Catherine, you say you found a different demo learner, or you just, okay. I don't want to get too distracted here, but you did find it. Okay. Great. Okay, well, perfect. If you're able to open this up, that would be great. Anyone else? But okay, so the two required components from a systems perspective are the contextual variables and the overall rating. You do want to and are, strongly encouraged to fill in the comments, but from a systems perspective, you can submit the form simply by having selected an overall rating and populated all of those contextual variable categories. Clicking on submit, like I said, will submit the form, and it will also direct you back to your main landing page here. You can see on my screen here, I received an email notification confirming that the task was completed successfully.
So you can see that once you get started on this, I know it appears daunting right now, and some folks haven't been able to do the demonstration, but once you get started, it is pretty quick to complete an evaluation. And the other thing is you can access this off your phone as well using that website. So that makes it a lot easier in the middle of a busy clinic if you don't want to go to your desktop computer or your laptop or whatever. But this can also be done off your mobile device. I know Alan's got it as well.
Alan?
Steph, Charles, I think what might be really helpful here is just have a one-page cheater, that we could just, maybe you could post it, we could download it, we can keep it around so that when we actually come to doing this, we can just go through the steps that you've outlined here. And, it'll help us with our learning curve. I'm sure once we've done several of these, it'll be a lot faster. And having it on your phone is going to make life a lot easier, especially for people who are, who are not GFT, who are coming just to run a clinic. So just having a one-pager, or maybe on two sides of a one-pager, that we could just print off for ourselves and keep as a reference would be very helpful.
Yeah, we can certainly do that. We do have user guides, and we can see about distilling that down to something succinct.
The thing with a user guide is it's so complete.
Yeah,
for necessary reasons that people don't read it.
Yeah, that's fair.
Really, what we need is something that is quite stripped down to the bone.
Yeah,
just get us through it. Once we've played with it, we'll know more how to use it. But to get us over that learning curve would be helpful. And the other thing is, just listening to this, it seems very top-down orientated. Be nice to get the residents, the incoming PGY2's input, so we know that, the main purpose of this is to coach them. A lot of what we're doing today, because this is what we're going to need to be doing as faculty, is evaluating them. But I think a strong emphasis has to be on the coaching component, and making sure that they're reaching their milestones and that they're in fact exceeding them.
Thank you for that. Speaking of the first, we can definitely share one pager to have that disseminated. There are also some step-by-step sort of instructions on how to bookmark that website on your phone so that it appears like as a shortcut, similar to a link that you can just open up and, you know, directly begin starting your assessment without having to type in the URL on your phone each time. In terms of readying the PGY2s and the incoming cohort for the requirements and sort of expectations for CBD, we will meet with them and convey that as well. But I do agree. I mean, you know, there certainly is a lot of value to be had in engaging with them and speaking with them to sort of enhance that coaching component and sort of establish expectations and, you know, of what on both sides of the assessor and assessee table. Okay, are there any questions or anything to add, or is there anything from either any of the attendees or from Amandeep or Stephanie?
There's one comment in the chat, Charles. Oh. From Myrna.
Okay, in general clinic, there may be more than one task completed by each resident. Insofar as that might then necessitate the completion of multiple EPAs. Yeah, I mean, if that happens, the opportunity certainly exists to have multiple separate assessments be triggered and completed. I understand that there's also maybe potential concern about that being a little bit, resulting in a bit of workload, you know, workload burden or assessment overload sort of thing. You know, these are intended to be low stakes, triggered often, right? But I certainly understand if that, you know, if there's concern about that, that certainly is something I think that would be, you know, discussed through what your one-on-one with the trainee, right? Maybe not every single one of those tasks requires an assessment, but, you know, it can be a good idea at the beginning of one's clinic to sort of discuss expectations for that day, discuss, I don't know, and I guess in clinic, would it be the case that you would have a clear idea about what, or decent expectations for what cases would be coming in throughout that day? Is it possible to plan? No, I see you shaking the head.
I mean, in the PGY2 year, it really is unpredictable what might walk in on a given day. I mean, this is an opportunity for the residents as well to make sure that they're, you know, getting regular EPAs completed for themselves so that there's not a rush at the end to get a whole bunch done in the last week or whatever. But try to space them out so that, you know, maybe the goal is to complete an EPA at the end of each clinic as opposed to multiple EPAs per resident. So that may help as well. So I'll remind the residents about that as well. You know, it's really important that we try to focus on getting these regularly, starting at the beginning of the rotation.
Yeah, thanks. I'd also add, I mean, there are general rules of thumb about expectations for EPA completion per rotation. It's roughly 2 a week, 2 attempts of an EPA per week. And also, I think your program specialty committee did a pretty good job about keeping the targets relatively low. So keep in mind that this particular COD EPA, right? I mean, there are 12 required completions, but those can be spread out over, I think, the next 3 years, technically, right? So I wouldn't stress too much about being bombarded with a barrage of these. You know, I think expectations around that will certainly be communicated to the trainees, but also on the flip side, I think they may, you know, they may find it to be more palatable, more comfortable for them to sort of space out the requests as well. I think, you know, they'll be mindful of kind of the potential burden that this can provide. But again, I guess that's part of kind of discussion with the trainees as well to establish those expectations. Any other questions? Any questions?
I don't see any, no.
Okay. Yeah. Well, are there any other, is there anything in closing you have? Oh, I see a question in the chat here. Okay.
Yes. So Nancy's asking to go back slowly and do the demo one more time. So let's start from the beginning.
Okay.
For someone who's just logged into the MedEd website, and where do they go from there?
Okay. So do you want me to, why don't I just go right to the very, so meded.utoronto.ca will direct you to this landing page here. You enter in your util ID and the associated password. Okay. Oops. So once the two-step verification, two-factor verification gone through, you'll be directed to this landing page here. Maybe this is easier. I think I should have just done this. I'll switch over to a faculty view. I don't know why I didn't do that to start. Okay, well, not particularly. So along the top for faculty, you'll have tasks and results, start assessment, and help. Help will direct you to that those user guides, but to begin an assessment, to begin an EPA, you'd select start assessment. From this
Can
page,
you just highlight that PGME faculty spot? Because I know
oh
people
yes,
involved in the
Good.
MD faculty that might cause confusion. So
Thank
the
you.
correct tab has to be highlighted.
Yeah, so that actually harkens back to a question that was asked early on about your work with the MD students. So at the very top, you'll have your name, and if you work with undergrad students, there will be a drop down between your name and the logout. You'll have two options, two different profiles, PGME faculty and MD faculty. They're different sites. Be sure you're set to PGME faculty in order to access the EPAs required for the ophthalmology training. So make sure you're set up to that account, that profile. Thanks, Stephanie. Okay, so starting assessment. On-demand workflow, we have EPAs selected. It will always default to the EPA here. For faculty, if you just have a faculty account and you are, right, if you're logged in as your faculty, in your faculty account, you won't need to select assessor. It will just automatically associate the assessment with your name. But I'm in this demo account here, so I'm just going to select my own name from select assessor. From this select assessee dropdown, all of the trainees across all programs in postgrad can be found here. Using this search bar at the top, you can begin to narrow them down. I'm just typing in demo. And I hope it's the case for all of you as well. There are just these 4 options that remain. The one that we have set up particularly for today and enrolled in ophthalmology is Demo Learner 2024, the 4th one. Selecting that, you next have to select the date of encounter. But you can see here, you do need to select this before moving on, but just we can see looking down a couple items under select a program, it should indicate that the only program this demo account is enrolled in is ophthalmology, and it should have that selected. Under date of encounter, you can select any date up to 7 days prior from the date of initiation, the date of triggering the assessment. So if it was today's, you select today. If it was last Friday's, we'll select last Friday. Under that, so as faculty completing this, you only have that complete now option, right? So you're triggering it, and the expectation is you're prepared to sit down, you're on your phone, and you're completing it in the moment of triggering. Under select an EPA, all EPAs across all 4 stages of training can be accessed. We are particularly, for this particular example, are triggering C1. So right, the 4 stages, transition to discipline occurs in the first year. Foundation in the first into the second. Core of discipline, where the bulk of the EPAs lie, will span the core of will span PGY2 into PGY4 by the sound. So once you've selected that EPA, you can either preview it just to get a sense of it, but for purpose of this session, we'll click on Begin Assessment. That will launch you to the live assessment form here. Under this assessor and assessee information, you'll have the date of encounter, which you previously selected, and you'll see the EPA with the little title associated with it as well. Below that are the contextual variables. So those contextual variables are the common pieces of information, some of which are common across all EPAs, such as type of assessor, type of assessment, rotation service, and site, and some are specific to each EPA. The items that appear here, the drop-downs that appear here that are specific to each EPA are included based on requirements laid or passed down to us by the Royal College. Those EPAs with those specific contextual variables, right? That was all determined by the National Specialty Committee. So ophthalmologists from training programs around the university, or sorry, around the country, decided which core activities, which EPAs were required and what each EPA should specifically look at. So once that was determined, right, and everything's finalized, we built the tools based on those specifications. So this contextual variable section, every drop-down menu must be selected, or an item from each drop-down must be selected. So you can see here, types of assessor, right? So you can see who is qualified and who was given the ability to fill that out. Type of assessment, right? Different options here, whether it's directly observed, case review and discussion. This type of activity dropdown, right? This is here because it appeared, it was, required as part of the EPA guide. So entering something there. The rotations associated, or, the rotations on which this EPA is likely to, this encounter is likely to occur, all listed here. The site, it's a live search similar to what we saw on that previous page for selecting an assessee. Linked to all training programs, right? So if you want to, narrow down, search for a specific one, just type in and it will narrow the search results. Lastly, for this particular EPA is that type of case or procedure dropdown. So selecting one of the items from here is required as well. Second component on this form is that feedback section here, right? So as we briefly touched on, ways and the importance of giving and receiving feedback and coaching, right? Be mindful of how to maximize the, the value that you can provide through your comments, right? Either providing, reassurance, through this first things to continue doing text box, or, the means for focused improvement under this things to work on box here. So very helpful for both the trainees progression as well as for the competence committee members who will be reviewing EPA completion data as one piece of the program assessment they'll review when making promotion decisions. Third component, second required component from the system perspective, is the overall rating scale. So based on your observation of that specific encounter, you want to evaluate, you want to provide an evaluative rating. Competent and proficient, those ratings count towards that target of assessment that is associated with this EPA. Support, direction, and intervention, require an additional attempt. It should go without saying, if there are cases on the lower side of this, I think you would be beholden to the trainee to, be quite descriptive under things to work on why they received that rating. It's also quite useful, quite helpful if there's time, or to make the time to speak directly with them, right? Either through the course of completing it, through informally, following the completion of it, but it's very important to communicate, I think, the results of this, particularly in the extreme cases where you felt you needed to provide significant support through the course of the encounter. Lastly, the milestones, those are the steps that are kind of mapped, associated with each EPA and mapped to the CanMEDS roles. They have individual rating scales, but you do not need to fill each of them in, but they can help sort of guide you, particularly in the earlier stages where you're familiarizing yourself with expectations and content for each EPA. Following that is a submit. There is a link here, save as draft. So if you got called away, weren't able to complete it in the moment, should have mentioned that earlier, you can select this and an email will be sent to you. And you can also access that partially completed EPA on your dashboard. and complete it. But be mindful, as I mentioned earlier, there's a 2-week expiry limit. So if you do partially complete this and there's called away, remember to, go back into the system and complete it. Any questions about that?
Thanks, Charles. I think that was helpful. I think one of the main issues we had was that many folks were under the wrong profile. So that's a good lesson for all of us.
Yeah.
That we need to be under the PGME faculty, not the MD program. In the interest of time, I am going to end the rounds here. But Charles, maybe you can put your email in the chat box so people can contact you. If anyone wasn't able to log into their UTOR ID or complete an evaluation through Elentra, I think it is important that we all go through this exercise before July 1st, because we will have to go through this after July 1st. So please do reach out to Charles there and try to troubleshoot any issues that you may be having. There's various points, logging into UTOR ID. There's now 2-factor authorization as well with the Duo mobile app, so people may be getting stuck there. And then with respect to Elentra as well. So reach out to Charles and the team at PGME to get set up for that.
Thank you. Yeah, apologies for not thinking about that drop down initially. So thanks to Stephanie for jumping with that. But thank you all for your time. I hope you found this to be helpful. My email's in the chat. Reach out anytime, and I'll share the slides and some resources and follow up as well. So thank you, everyone.
Thank you, Charles. And then just on behalf of the department, thank you to you and the team at PGME for the last 2 weeks. This is our last grand rounds of the year, so everyone has their summer off. So thank you to everyone for the academic year, and we'll see you guys in September for grand rounds. Have a good weekend.
Take care.
Bye.